So my name's Jane Wilcox. I'm a heart failure transplant cardiologist here at Northwestern Medicine. I'm an associate professor of medicine at Feinberg School of Medicine, and I was recently named the associate chief of cardiology here at Northwestern Medicine. I have had this long-standing commitment to heart failure transplant, heart muscle recovery, and cardiomyopathy and genetics, and that comes from a personal experience with my father really being exposed to that at an early age. He had cardiomyopathy for a long time, and when I'm meeting with patients in clinic and talking about their disease process and their genetic underpinnings, their plan for recovery, I am always reminded of how I felt, interacting with the physicians that were taking care of my father. And so I do really have that personal connection with patients, and that's something I really treasure. So I'm a bit of a Northwestern lifer. I've been here since 2007. I did my internship, internal medicine residency, was a chief resident under Dr. Diane Wayne, and then I did my cardiovascular fellowship and finally heart failure and transplant fellowship in 2014. So Dr. McCarthy and Dr. Yancey, there's not much more to say other than they are luminaries in their field, respectively in cardiovascular surgery and heart failure and cardiology. They have really been pioneers, and we stand on their shoulders. And so I'm just so grateful to have learned from them over the years, and now being colleagues is really special.
So we're really excited to have Jane Wilcox join us in Bloom Cardiovascular Institute, and she's going to join us on the executive committee. We meet weekly, and we're planning strategy, and we're planning tactics across the entire system. It's not just in cardiology, it's also in cardiac surgery and in vascular surgery and everywhere that we touch patients that are in the cardiovascular realm. So her insight, her experience, her enthusiasm are going to be welcome additions.
One of the really important things that all leaders should embrace, Northwestern Medicine and beyond Northwestern Medicine, is leaders should make space for new voices, for new talent, for new dynamics. And that should be, broadly speaking, otherwise known as it should be inclusive. That means we should make space for women to lead. And who better to be an emerging leader than a dynamic woman who is already a national leader in cardiovascular medicine. We are fortunate that she works with us, not for us, and I'm delighted in her new role as an associate chief that we're further elevating her space, because it means that all the other women see that path forward. We are not leaders worth anything, if we don't make space for others to move up into that space. That's why this is so incredibly important.